So now we'll be talking about the risk factors and the etiology, that is the causes of irritable bowel syndrome. Risk factors and etiology do show that irritable bowel syndrome does have an genetic predisposition and that it does run in the families. The best accepted risk factor that have been known is the bacterial gastroenteritis. So bacterial factor has been shown evidence that it could be one of the cause of irritable bowel syndrome, but it can also be non-bacterial gastroenteritis such as viral gastroenteritis, and it could also be infections with trachinella or giardia. So these are the reasons why a patient might have the gastroenteritis. It could be bacterial, viral, or any other infection, but bacterial has a more common predisposition. So now if we talk about the risk factors in detail, first of all, if we talk about the psychological factors that are present, adverse life events are usually one of the reasons why a patient might be having irritable bowel syndrome. The relative risk is around 2.0. It could be because of some psychological issues such as depression, hypochondriasis. The risk factor for this is 3.2. Age more than 60 years has a relative risk of 0.36. Females are usually more prone to having irritable bowel syndrome, so the relative risk is around 0.36. And smoking has also shown significant evidence in increasing the chances of patient having irritable bowel syndrome, which is relative risk around 4.8, which is among the highest among all these. If we talk about GI tract related risk factors, lymphocytosis is one of the reasons why a patient might have irritable bowel syndrome. The relative risk is around 3.2. Enterochromaffin cells hyperplasia is also one of the main reasons. The relative risk is around 3.8. Elongating toxins, any evidence of having toxins within the bowel or within the colon epithelium could be one of the reasons. And as you can see, if we compare with all the other risk factors, it has a relatively more risk factor than all these others, having 12.8. And then having a duration of initial illness. So having irritable bowel syndrome for a very long period or having it for a long duration is also one of the risk factors of initiating it more, and it could be persistent. So the relative risk is around 11.5. So this consists of all the inflammation that is going on in the colon. And then this usually is because of the pathophysiology, which we will be discussing further. So now if we talk about the etiology, which is the causes of irritable bowel syndrome, there are a few listed over here. Irritable bowel syndrome could be because of abnormal gastrointestinal movements. It could be because of the changes in nervous system communication. As you all know that the brain and the gut axis is dysregulated in a sense, and that is the reason why irritable bowel syndrome usually is created in a person. Sensory and motor disorders of the colon, this also comes under the brain and gut axis, and we'll be talking about that in the pathophysiology. Some sort of dietary allergies, some food allergies could also be one of the reasons of a patient having irritable bowel syndrome. Neurotransmitter imbalance and stress. Usually stress can also be one of the reasons why a patient might have irritable bowel syndrome. We'll be talking about all of these things in the pathophysiology, and we'll be talking about them in detail, that how do these things happen.